Meningococcal meningitis, a bacterial form of meningitis, is a serious infection of the thin lining that surrounds the brain and spinal cord. It can cause severe brain damage with fatality in 50% of cases if untreated. Several different bacteria can cause meningitis, and the Neisseria meningitis is the one with the potential to cause large epidemics. Epidemics in the meningitis belt occur in the dry season, which brings low humidity, dusty conditions, and make people more prone to respiratory infections, and then facilitates the spread of bacteria. Meningitis is transmitted from person to person through droplets of respiratory or throat secretions from carriers. Close and prolonged contact, such as sneezing or coughing on someone, or living in close quarters and sharing eating or drinking utensils with an infected person, facilitate the spread of the disease. Meningitis comes with symptoms such as headache, fever, and stiff neck. The largest recorded outbreak of epidemic meningitis was recorded in Africa in 1996, with over 250,000 cases and 25,000 deaths registered. Nigeria was hit by meningitis in 2013 and 2014, particularly in the northwest of the country. There was a recurrence in 2015. The outbreaks occur over a wide geographical area. Hundreds and thousands of deaths were recorded in the outbreak that lasted 17 weeks, affecting over 1,000 villages in 21 local government areas of 3 states, that is, Kebbi, Sokoto, and Niger states. Same year, Nigeria completed the conduct of mass campaign of CSM targeting the commonest cause of epidemic meningitis, serotype A, in the 26 states of the country that are in the meningitis belt of Africa, a region in sub-Saharan Africa where the rate of incidence of meningitis is very high. This region stretches from Senegal up to the Horn of Africa. It's that time of the year again, and the northern region is hit by meningitis. Over 14 people have been confirmed dead, while over 300 others infected following an outbreak of type C meningitis in Sokoto State, northwest Nigeria. The type C meningitis is said to be the most dangerous of all and can kill its victim within 2 to 3 hours of infection.
Well, the hospital data, according to the list that we have as at yesterday, is over 300, going to almost 400 people. We are going to have an evening review this meeting for updates from all the centers that we have across the state. We are going to update our records on the number of infected and number that has been treated. And we have recorded 14 deaths that are confirmed from cerebrospinal meningitis as of yesterday. As I've told you, we're going to have evening review meeting today with all the teams, back at the Ministry of Health to re-strategize and see how we can move forward. But all the same, the reports I've been having is that we are having reduction in the number of cases in some local governments, while in other local governments where we have done community mobilization, we're having more cases being brought in, which is good. So that people don't keep them at home and they continue to transmit the disease and then have high mortality. In 5 local governments as hotspots, including Tureta, Bodinga, Wamaku, Gada, as well as Dengeshuni. An emergency response and Kebi. Emergency response teams have been discharged since 2 days ago, 15 in numbers, comprising of doctors, nurses, pharmacists, and laboratory and scientists, with enough medicaments, commodities, as well as other logistics to contain the scourge. Referral centers have been set up in general hospitals across the state, and hotlines have also been given out to the people, and we are going on massive community sensitization, mobilization on key case definition of what are the signs and symptoms of meningitis, so that people can rush to the hospital.
Health officials move into villages with emergency response ambulances evacuating infected persons, while other teams sensitize locals on prevention measures.
We really go down to the community and then give you a dose of
In Turaita local government area of the state, infected persons receive vaccination while worse conditions are evacuated. Wamako, Dange, Bodinga and Turaita are currently the worst hit local government areas, and according to report, the situation may likely worsen by spreading.
Poor status of immunization, that's the truth. That's why we are really going out to tell people they must take up and increase the uptake of routine immunization. All these outbreaks occur when the herd immunity, community immunity is low. And then once you have a hot season around and then the bacteria has already been inoculated, you get outbreaks. But with this new strategy, inshallah, we hope with higher uptake of routine immunization, targeting 80%, the herd immunity of Sokoto State people will be high, and we stop these outbreaks. And in trying to see how we can coordinate effort in combating this scourge, and it has been very excellent. With also Medicine Sans Frontier, we are also working with them, and currently we are working with the ICG to procure vaccines, to do mass vaccination campaigns for this type C. It has been a success, the one we did last year, the active vaccination, but this year we want to widen it so that we never again have meningitis in Sokoto State.